I'm going to go ahead and walk in the room and do hand hygiene. Hello, Mr. Smith. My name's Ayana. I'm your student nurse today. I'm here for a catheter insertion. Can you go ahead and tell me your name and date of birth? Okay, that matches my order here. And are you allergic to any iodine or latex? No. All right. So I'm going to go ahead and pull my privacy curtain for you, Mr. Smith, because you're going to be undressed for this. I have all my supplies here, my catheter kit, gloves, and a waterproof pad. I'm going to verify my order one more time. It's for Matt Smith, a catheter insertion, because you are on strict intake and output orders, Mr. Smith. So I'm going to go ahead and put on my gloves. I'm going to put this waterproof pad underneath you, Mr. Smith. Alright, and I have some wipes here, Mr. Smith. I'm going to go ahead and clean your penis. I'm going to go around. And while I'm doing this, I'm checking for any signs of infection, which Mr. Smith doesn't have. So we're going to go ahead and take these gloves off, throw them in the trash. So now that the gloves are off, I'm going to do hand hygiene again. And this is where the sterile procedure starts. So I'm going to open my kit and I'm going to make sure not to reach too much. And my desk isn't big enough, but we're going to pretend that it was bigger and I had an area to put these on sterile. Okay, so now I am sterile and I have to be careful of the way that I touch things and the way that I move. So the first thing I have, besides the gloves, is this waterproof pad. And I need to put this on Mr. Smith, under Mr. Smith without touching him. So I'm going to go ahead and fold it like that and just stick it under him. And then I'm going to grab this. And I'm going to place this over your penis, Mr. Smith. And then I'm going to just move my trays a little bit. And I have my jelly. I'm going to go ahead and empty that out. And then I have my 3 iodine swabs. I'm going to take them out and set them up. And I'm going to stick my tube into my jelly. And go ahead and get my 10 millimeter saline syringe plugged up so that I'm ready to go. Okay, I'm going to go ahead and touch your penis, Mr. Smith. And I'm grabbing with my non-dominant hand, and I'm going to grab my first iodine stick and start at the meatus and go around. Throw the first one away, grab my second one, repeat that same step, meatus and around. And then grab my last stick and go around. And then once my hand is there, I can't move it. So I'm gonna just use this sterile hand for now. I'm gonna dip my tube one more time into the jelly. All right, Mr. Smith, I'm gonna go ahead and insert this in you. Take a deep breath. And I'm going to feed it all the way until the Y, making sure not to let go of the tube. Once I'm there, I'm going to go ahead and not pinch, but hold on to it, keep it in place with my non-dominant hand. And then go ahead and inject that 10 milliliters of saline solution. Alright, once I do that, I'm going to unhook it, and I'm going to test that there's resistance to make sure that the balloon is inflated. And I'm going to go ahead and take off my gloves, and I would tape the tube to his thigh. then I would place the bag on the bed frame of the bed, and then just go ahead and pick up all of my mess, and then lower the bed for Mr. Smith and give him his colic. Hand hygiene. Hello, Mr. Smith. It's me again, your nurse. I have an order here from the doctor that this catheter is ready to be taken out today. Will you go ahead and tell me your name and date of birth? Okay, Matt Smith, March 22nd, and that does match my order. I'm going to go ahead and pull the privacy curtain and verify one more time. This is for Matt Smith today, and it's a catheter removal. So I'm going to go ahead and put my gloves on. And I'm going to put this waterproof pad underneath you. Okay, and then I'm going to empty your bag, but first I'm going to make sure you had any urine. You had 350 milliliters of urine. So I'm going to go ahead and empty that out and place it on the bed. And then deflate this balloon. Right, once I got that, I'm just going to gently remove it straight out and catch any urine on this waterproof pad. And then untape the tubing from his leg. And then I would go ahead and just put all of this in the biohazard or trash and remove my gloves. Perform hand hygiene. Okay, Mr. Smith, I'm going to place this call light near you. It's really important for you to use the call light to call me on your first void, the first time you think you need to go pee again. Any other personal belongings I can put near you? Okay, and I see you have no pipes or anything because we just got that taken out. Do you feel any pain? No? Okay, you look like you're in a good position, right, Mr. Smith? Okay.